Hello there, this is Andrew Kohlmeyer, and I am at Andrew Kohlmeyer Massage, and today I would like to talk about medical massage and the approach to helping clients who come in with a stroke. So what happens when someone has a stroke, they can lose perception in a limb, a portion of their body. So what happens is they can't feel when there's resistance in a limb. So the movement will be chattered. So what you have to do is you have to even out like both sides of the arm. So you have a flexor side and you have an extensor side. So both sides have to be of even tone. You have to reduce anything that is in there that would cause resistance to a movement of the arm. They can't perceive these little small, variances. So you have to take that stuff out so their movement can be predictable with visual cues. And yeah, so, you have to go through and palpate. If there's anything in there, you have to take it out. The common spots are the biceps tendon here that can often become mineralized. You're going to want to reduce that. That biceps tendon runs in the bicipital groove. You're going to want to get that mineralization off there. The biceps tendon runs like this. You're going to run like that. You're going to be able to break that stuff up. And what that's going to do also is that's going to reduce inflammation. And with inflammation, it's going to raise the action potential of that muscle to over threshold where that muscle fires somewhat. So that's semi-energized. So then they have to move against that. And that is just not going to happen. They're not going to be able to handle that, and their movement is going to be really chattery. So you want to clean that up and reduce that inflammation so that muscle can shut off. It literally will shut off back to its normal state until their normal process calls that muscle into action. And that is the big gist of all of it. The legs, you have to make sure they're not caught in a roiling spasms. They're having trouble with the length of their Achilles. You have two gastroc muscles and then your Achilles. So first of all, they have to be all separated. They can't be fascia adhesions. Fascia is like the clear plastic bag that each muscle is in, so they all have to be separated. They cannot be, basically all kind of glued together. So, obviously, you're going to want to palpate for that kind of things. You want to make sure that Achilles calcaneal tendon doesn't have a whole bunch of material here locking that tendon in place, so they can take, a normal step. They can operate that. And that's the same thing here. This is a big area of inflammation. So behind the knee, you have all these tendons that go up there. You have to clean those up. You can't have that inflammation, that backwards lymph pressure. And lymph pressure is a really big topic to bring up. So all of your legs here drain into here. This is the L2. It's called your cisterna chyli. So everything has to flow into this cisterna chyli at L2. So you can't have, areas of tightness that are just pocketing that lymphatic fluid. So, the common spots are behind the knee where it just dams up the lower leg. And then that leg has to operate with that higher compartmental space. That space is being stolen. So those muscles have to work much harder. So that has to be reduced. The hips have to be reduced. And how I do it, to really make it, far more comfortable is I use, this is like a potato masher or whatever. And I just, use motions like that, same down here, but that's after I reasonably clean it up enough where I palpate what's going on. I'm checking for sciatica. This is the sciatic nerve through here. That's going to be a huge driver for inflammation as well. Especially in this region, if it just feels like, why is this so swollen there? You want to try to gingerly get into there. It's like you got to charm the snake down in there so you can get down into that that nerve and get it. You know, the nerve's the size of your pinky. It's huge, you know, so that's going to cause a lot of dysfunction in there if that process is in place. Let's see, what else we got here. You know, that is pretty much it. It is really rewarding to work on people who are going through this issue, because it's not that complex. Once you do a few of these, you know, you'll get the feel for, you know, how everything has to operate perfectly. They have to be back to stock. They cannot have any variances. Everything must be cleaned up. So that is about it. And hopefully this helps. All right, bye.